clock, my watch. I'm going to call the January Public Safety Committee meeting to order. Madam Clerk, we got to include this agenda. We got to do roll call. We're going to do roll call. So, Lynn, can you do roll call?
Sure.
You have a roster?
James Schlender,
Present.
Ron Buckholz,
Present.
Ed Peters,
Present.
Dale Schlueter,
Here.
Chuck Van Etten,
Here.
Tom Hoff.
Tom's not on the committee. We're good.
Okay,
So, Madam Clerk, are we in compliance with open meetings laws?
it has been posted, yes.
Meeting agenda has been circulated. Is there any questions about the agenda? Hearing no questions, public comment. Is there anybody who's present, who's not on the agenda, who wishes to address the committee? Anybody here in the room? Anybody online? Mr. Colson?
No hands up.
No hands are up. Moving on to number 5, minutes from the previous meeting. Minutes have been distributed. Is there any comment or concerns or edits or revisions to the minutes from last month? Chuck, do you got any questions about the minutes?
I do not. Thank you.
Entertain a motion.
Mr. Chair, I read the minutes. I wasn't here for that last meeting, but I did read the minutes and I'll make a motion to approve as presented.
I have a motion from Mr. Buckholz. I have a second from Mr. Peters. In discussion, the minutes have been presented. Any questions on the motion? I'm going to call for a vote. All in favor of the motion indicate by saying aye.
Aye.
Any opposed? Any abstentions? Motion carries. Next, we go to Judge Yackel. Is Judge Yackel present? Okay, moving on to Clerk of Courts report. Madam Clerk, we received your report. You wish to address the committee?
I would like to add, it was not on my report at this
Can
time.
you come up a little bit closer? We have an open chair with a mic. If you want to just grab it over here. We do have some members that are virtual that are going to have a hard time hearing.
I'm not going to be able to stay because I have a big report that's due tomorrow. So.
No one wants to stay.
I just want to let everybody know that my Chief Deputy Jill Tunn is moving from my office to the DA's office. She will leave a huge void. We will miss her. But I am hoping that we can replace or refill that position. So.
Okay. Any questions for the clerk? Any questions for the clerk's report? Chuck, you got any questions?
I do not. Thank you.
Thanks, Mark.
Thank you, Mark. Moving on. Number 8, District Attorney's report. Do we have the District Attorney present? Mr. Golson?
No.
Moving on to child support. Child support did submit a report. Is there any questions on the child support report? She's not present. Moving on now to the sheriff's report. Sheriff, the floor is yours. Chief Deputy.
I'd like to start off by mentioning that our agency has reviewed after closing out the year. Obviously, one of the biggest challenges we had this year was a larger than normal number of traffic crashes. And I want to take a few minutes and go over some of the data collection and what we came up with in our review. On April 17th, we had our first fatality crash. It was on Highway County K in the town of Bass Lake. It was a 1 vehicle with 3 occupants, and ended up with 2 fatalities out of that accident. Primary factors was impairment by alcohol and speed. On May 21st, we had a 2 vehicle crash in the village of Winter. It was a car versus a semi. She pulled out in front of the semi, failing to yield from a stop sign, and obviously failing to yield was the primary factor there from a stop sign. On June 22nd, we had a 1 vehicle crash In the town of Winter, it was a vehicle left the roadway. The driver, single occupant, was trapped, not ejected, major trauma. And impairment by alcohol was a primary factor. On July 19th, in the city of Hayward, there was a one vehicle versus pedestrian. And the primary factor there was alcohol, impairment by alcohol with the pedestrian. On July 25th, there was a one vehicle motorcycle crash on Highway 40 south of Radisson. On a sharp corner, a motorcycle failed to negotiate the corner. He was not familiar with the area, being out of town, and was transported by ambulance initially, and days later succumbed to his injuries. On July 29th, there was a two-vehicle crash. One of the vehicles had 4 occupants in the vehicle. The other one was a single occupant. It was on State Highway 2770 or 2777 at the intersection of County Trunk Highway T in the town of Lenroot. Head-on crash. The one vehicle with 4 occupants, it was a mother, her young adult daughter in the passenger side seat, her son in the back seat behind her, and the girlfriend's boyfriend in the back seat. And both of the males in the back seat were deceased on scene. And the driver in the other vehicle and the driver and daughter in the one vehicle, what probably saved their lives without question is airbag deployment. And the 2 in the back seat not having airbags was a disadvantage for them. The one vehicle with 4 occupants was traveling about 55 miles an hour, and the other vehicle estimated traveling at 35 miles an hour, and it was almost a direct head-on crash at that intersection. After further investigation, it appears that the driver, the mother with the 4 occupants traveling from Superior, was coming to Hayward to pick up prescriptions at Walmart for her daughter, fell asleep coming around the corner and hit the other vehicle head on. So that's an inattentive driving by falling asleep. On August 12th, in the town of Draper, there was a one vehicle, a commercial motor vehicle, semi, rolled, lost control around a slight curve, a rollover, and smashed the cab almost right down to the frame of the truck. And it took over an hour to extricate the driver out of that semi. Unable to determine exactly, but it is possible that that was a distracted driving factor. On September 7th, there was a 2-vehicle crash, one involving a motorcycle with a husband in the front, his wife behind him on the motorcycle, was unable to negotiate the corner, a sweeping sharp corner by Cisco's on CC, and left the center, traveling south, and sideswiped an oncoming vehicle. And the driver of the motorcycle was deceased on scene there. Again, the factors there was failing to negotiate the corner. Obviously too fast for conditions for the driver, not necessarily too fast for the posted speed limit, but you still have to maintain control of your vehicle at all times. On September 10th, a 2-vehicle crash. This one was the one that involved a Bruce School District school bus. There was a bus driver with 4 children on the bus at the time. The bus driver, it was about 6:30 in the evening, going to turn left while heading north on 40, looked to the left. It's just at that time of day where the sun is at just sunset, and determining factors was obscured vision from the sun. And then when she looked straight ahead, there was an oncoming copper-colored SUV that she failed to yield while making a left-hand turn, and ended up being a angled head-on crash there. And the driver of the oncoming vehicle was pronounced deceased at the scene. Looking at the map of all of our crashes in Sawyer County, they're spread out pretty evenly throughout the county. So there's no factors as far as roadways or areas that's relative to the crashes. We did take all the data and identified the probable reasons for the crash. Impairment by alcohol per driver, there was 2 crashes. Alcohol by pedestrian was 1. Driving too fast for conditions, failing to negotiate a corner was 2. Speed was a factor with 1. Failing to yield from a stop sign was 1. Inattentive driving, falling asleep was 1. Distracted driving was 1. And failing to yield to oncoming traffic was 1. Additionally, all Wisconsin counties are required to have a highway traffic safety committee, which is made up of a representative from the highway departments, law enforcement agencies, including the state patrol, the ambulance service, the county emergency manager, a representative from the school system, other community members, a state engineer, and a traffic safety representative from the state. These traffic safety committee meetings are required to be held quarterly. And at these meetings, this committee, which I'm chair of, goes through all the accidents and all other highway traffic safety issues of concern. And we go through and analyze what there are for concerns, and with the state engineer and other state employees, go through and try to ratify any safety concerns from there. In our November meeting, we analyzed or summarized what we collected for data on all 11 of these traffic fatalities, which were 9 accidents with 8 other personal injuries, and found there was no common denominator. The state representative said that this was a common anomaly with a lot of the other counties as well. Also want to mention that after a decline with the state fatality rate, traffic crash fatality rate, the last 2 years, this year is up at the state level. I also want to mention with the traffic crashes we've had, the drug overdoses, the increased mental health calls, and the COVID challenges, that all of our staff and other county agencies such as the ambulance service and our fire departments, it has been a very overwhelming year, but I am proud to say that our staff is very, very committed in enhancing public safety in Sawyer County. And I commend them all for the service in all the agencies for what they've done, especially in 2020. I'll turn it over to the chief.
Chief, before you get started, is there any questions for the sheriff on the initial report?
I have one. Are there similar increases in adjoining counties to Sawyer County?
I get my understanding, and I didn't research this directly, but it's communication with our trooper sergeant. He said that Polk County had a little spike, or quite a spike, in traffic crashes as well. and just a lot of unique crashes. I think one of the things, obviously, we've had a major increase in people in our community, especially coming from Minneapolis. But, you know, there are a lot of these crashes do involve locals as well.
Chuck, do you got any questions for the sheriff?
I do. Sheriff, I appreciate that report. It was very, a lot of information in a short period of time. My one question is, in other states and other counties, the sheriff's department opts out. And my question is, do you actively work these accidents and so forth, or do you just assist in traffic control?
We do analyze it in our traffic safety committee. One of the reasons that we talk about this extensively is, and Lieutenant Rapinski's there, usually when it's not a conflict otherwise, or the information gets forwarded to him. And then we try to schedule and encourage when time is available for law enforcement, and we'll work with the state patrol as well to do added enforcement in those areas. If there's factors of driver behavior, the cause of the accidents, to try to reduce crashes and fatalities and injuries in those areas. Does that answer the question?
No, I'm sorry. Maybe I phrased that wrong. Does the county actively work the actual accident or just do traffic control?
We investigate. Most of these crashes are investigated by our agency with assistance from other agencies. We will bring in the state patrol and do reconstruction on almost all of these traffic fatalities, but the accident report, we are the primary investigator and the agency that completes the crash report.
Okay. And then also, does the sheriff's department, do you have a traffic like designated team that doesn't do just patrol, that they are just slated for traffic?
No.
Has it been like that in the past, or is that just the standard, that's how it's always been?
No, with staffing issues, we try to maintain 3 deputies on at all time. And with the area that they have to cover, with staffing issues, we found it to be pretty difficult to do that. And it benefits the community and the agency better to serve by having the universal standards there of trying to accomplish all missions there by one person.
Okay, thank you. That's all I got.
Any other questions for the sheriff? Mr. Buckles?
Sheriff, I really appreciate that info you just give us. That's very, very knowledgeable stuff for us to have here. We really appreciate that. Thank you.
Thank you.
Mr. Schluter, do you have any comments, questions? Moving on, Chief Deputy, floor is yours.
I have Corey's dispatch report. Corey has completed the joint power agreements, and they'll be sent out to all the townships that we dispatch police, fire, and EMS to. As I mentioned in previous meetings, we hired 2 part-time dispatchers, and one of the young ladies has completed her training and can work on her own now, and the second is nearly completed with his training. And we also had one of our part-time patrol deputies interested in the dispatch, so they'll be cross-training him in that area too. Still working with North Memorial regarding the emergency medical dispatching contract. And I see this morning in my email, we did get a copy of that contract from the legal department, so we review it and send it to our council, and hopefully that'll all go well. And they're continuing to work with the rip and run system. They're now looking into the active 911 emergency response mobile app. So they're trying to get all this to work together. So it's been a little longer process than we thought it was going to be. Total number of phone calls received in December was 3,771, which is down from a little bit from last year. And actual calls for service in December were up a little bit from last year. So, and for the total for 2020, the dispatch center received 19,224 calls for service, which is up from the previous year.
Any questions for the chief deputy? Chuck, you got any questions for the chief deputy?
I do not, thank you.
Lieutenant?
A control report is attached along with the totals for 2020. Just some comments there. We are continuing to see a slight uptick in calls for service for patrol deputies, increasing, trending upwards from October of last year through current December. But it is an increase from this time 2019 of 181 calls for service. So we are ballooning out. We have answered just under 11,000 calls for service for patrol deputies. And to piggyback off of some of the comments on the accidents, we account for about 25% of our call volume is traffic enforcement. And it was just a bad year last year.
Any questions for Lieutenant Rapinski? Chief Peters?
I do notice quite a number of suspicious persons and suspicious vehicle requests or investigations. Is that similar to other years, or is it?
It's about steady, yeah.
Okay.
Yeah.
I had a couple people in my area being concerned about that and noticing odd vehicles in driveways and so forth. So,
More than just Viking fans?
yes.
Chuck, you got any questions for Lieutenant?
I do not, thanks.
Moving on to the jail report, Lieutenant Johnson.
My report's attached there. I'll just kind of touch on some of these numbers here. For the average daily population total, you can see the December total, and then the 2020 total, which is obviously down significantly from last year. As well as at the bottom of my report, the total number of bookings in 2019 versus 2020. This would be attributed to COVID precautions as far as misdemeanor offenses being referred instead of arrested and booked in. And then my thought for the reason that the total bookings is lower is due to any referrals that the DA has gotten due to their caseload either haven't gotten to yet or have decided not to file charges, which would not then or would not create a booking at that point. So.
Sure.
I would just like to add, as the lieutenant mentioned, with the COVID concerns and issues of concern, a lot of the number and changes. And that was a cooperative effort with the district attorney's office and the court. And it has been great to work with our district attorney's office and judge as well, because we accomplished a lot. To date, we have not had any COVID cases in our jail.
That was a question.
So that has been a great cooperative effort. And we've been very fortunate, very blessed so far.
So to be clear, then, what the report is that for the COVID pandemic, there have been no reported COVID positives or any kind of COVID incidences under the jail?
Correct.
Excellent. Any questions for Lieutenant Johnson? Chuck, you got any questions for the jail lieutenant?
I do not, but I do have another question for the sheriff.
Go ahead.
Out of all this reporting and these numbers, do you actively have UTCs, Uniform Traffic Citation? Do you have any numbers on that? And if you don't have it now, that's fine. I'm just wondering, is there a record of that for how many UTCs were issued, say, last year and then this year?
We do have a record of that, as well as warnings, verbal and written warnings.
Okay, I would like to get with you in the future and take a look at those numbers and see. I'm sure when you're sitting on the Highway Traffic Safety Committee and you're working with the other ones, that if there's any kind of connection to the amount of traffic enforcement and the fatalities.
Be happy to meet with you.
Thank you.
Any other questions for the sheriff's department?
Mr. Schmidt, if I get one clarification from Mr. Motek. You were working with the DA and what other?
The judge.
The judge? Okay, thank you.
All right, moving on to animal control report. We have a report from Ms. Shelton. Is there any questions regarding that? Chuck, do you have any questions regarding the animal control report?
I do not. Thank you.
Okay, moving on to the coroner's report. We have the coroner's report that's been submitted. Any questions on the coroner's report?
I'll just elaborate on it if there's no questions so
Can you
far.
identify yourself for the record?
Jim Ornerheim, Deputy Coroner.
Say it with feeling so we can get you on there, because there's people probably can't hear you.
Jim Ornerheim, Deputy Coroner, Sawyer County. What John wanted to just elaborate on to make sure everybody understood, in 2019, I'm just going to give you a quick rundown. There were 73 deaths total for the year. There was 117, which he refers to as other, and these could be incidents that we get involved with possibly from several years ago. Maybe for some reason somebody wants some information. We got to do follow-up, got to do some research for these people. Or it could be incidents such as cremations, deaths maybe that the patient originally started in, let's say, Wisconsin or in Hayward, maybe got transferred to Duluth for extended care, and all of a sudden maybe passed, at that facility, then came back to Hayward because of cremation, whatever. So it was 190 total for 2019. In 2020, so you can compare 86 deaths in the county that we investigated, 126 other incidents for a total of 212. Of course, from 2019 to 2012, we got 190 versus 212, so that increased a little bit. In December, just for last month, to give you an example, there was 5 deaths in the county, and there were 17 other incidents that we got involved with for a total of 22. And autopsies, of course, which are performed occasionally throughout the year. In December, there was no autopsies that had to be performed. So that just gives you kind of a little bit of a rundown in regards to that. The other thing that we were concerned with back, I think it was in probably the November meeting that I talked about a little bit, because we had a real serious case, had a death down in Radisson. This individual apparently lived by herself. She had, I think it was like 12 or 13 cats living with her and a dog and everything. And of course, once the ambulance arrived, they right away noticed that I don't want to refer to this place as hoarding, but it was just unsafe living conditions. And I passed a picture around at the time that you saw. Living conditions were unacceptable. They were just terrible. I mean, there's cat pieces and dog pieces that were just piled up in the entryway. There was so much garbage and litter throughout the place. And again, unsafe. And of course, I explained that I was involved prior to coming to Sawyer County, what was called at that time a hazardous living condition committee down in Eau Claire. We had representatives from the health department, which actually the health department kind of more or less headed this committee up. Legal counsel for the county and also for the city, law enforcement, coroner's office, EMS, fire. We had representatives from everybody. And every time we had a problem, we tried to address it. We tried to always make conditions in the county and in the city of Eau Claire a lot better. So when law enforcement would respond to a call, fire, coroner's office, again, fire department, they would have a lot better situation because, again, it's not safe for the person that lives there, but it's also was not safe for these agencies when they would have to all of a sudden respond to some type of emergency. So that's the main reason. And of course, we got a lot of churches involved that helped clean these up. So I know you had mentioned, I think you would wanted Tom Hoff and myself perhaps to get together, and with the holidays and everything, that hasn't happened yet, but if that's still your wish, we'll put put it on the agenda to try to meet with Mr. Hoff and, try to maybe do some more research and get some information. If you want to go on your own and just look at the city of Eau Claire, they have a ordinance that's in place and will explain everything I just talked about on the city of Eau Claire Fire Department's website.
Okay,
on the
so
City of Eau Claire.
you're conflating issues. So right now we're only on the coroner's report. And I didn't want to interrupt you because you were on a roll, but the only thing that we're discussing right now is just the coroner's report. So is there
Yeah,
any
okay, I'm sorry.
more information about the coroner's report? Any questions for the coroner's report, Mr. Peters?
Yes, I appreciate, Mr. Ahern, that the detail that you provided in addition to the written report from the coroner. I was just wondering whether or not that kind of information could be included in future reports, especially on an annual basis, for the benefit of this committee.
Yeah, I can talk to John about that. He got called in to work this morning, and so that's why he's not here and not available. But I will talk to him about it and make sure that these numbers and everything are included, so you get them every month. I got these numbers from him, so he very easily can get these numbers. And I apologize for that, but I talked to John about that particular call I talked about in Radisson, and so this whole thing initiated through the coroner's office.
Right, and we're about to get to that. Mr.
Yeah.
Buckholz.
Yeah, and I agree with Mr. Peters there. We used to get a breakdown of all these deaths, and I would like to see this committee get that back. This year really don't tell us much. But if we could get the breakdown like he was giving us previously, would be very nice.
Sure. Would you like ages of the individual, or?
I guess,
we can't, give you a whole lot, but I mean,
no,
again, without.
he used to have it, what it was that they passed away from, and then especially now being this COVID, I believe a lot of people would be interested in that, and if you could just break that down, like heart attack, whatever, suicide, COVID.
If you can have Mr. Promo just meet with Mr. Hoff, there's the reports from the previous coroner.
Yep.
Will be on record. That would be a good template for him to follow.
Okay, so just
and
follow
provide
that format.
information. Any other questions for regarding the coroner's report? Chuck, you got any questions for the coroner's report?
I do. Mr. Buckholz made a very good point. My question is, and I read the disclaimer at the top about that doesn't necessarily mean they were killed by COVID, but do we have any numbers and of the COVID deaths, and is that an automatic autopsy, or do we just go by they tested positive, so then we put it in that category that they died of COVID?
So I don't know if you're prepared for that. I don't know if that's a question that we could really get into with this one, Mr. Van Etten. I think Health and Human Services is the better venue for that because you got the medical professionals that could speak to that. The coroner probably would report the death, but I don't know if the autopsy and other things would be necessarily, if that's a reportable incident. Chuck, I don't mean to cut that question off, but let me look into that question to find out if that's something that's within the jurisdiction of this committee.
Okay, thank you.
Any other questions? All right, moving on to emergency management. Ms. Sanchez, the floor is yours.
Good morning, everyone, and Happy New Year. In front of you is my report. I do have something else to add. FEMA, I don't know if you can see it, but FEMA just approved our multi-hazard mitigation plan. So that gives us another 5 years to work on applying for mitigation grants through FEMA. So that's a good thing. So now we've got another 5 years before we have to redo it again. It's a pretty extensive project, took about a year of multiple meetings, and then COVID came and that kind of added a damper to it. But we got it through and we got it approved. So that's a really good thing to our LEPC, which is our local emergency planning committee, which we do have a meeting on the 20th. If anybody would like to join, we'll be doing it via Zoom. Yesterday, just to give an update, every Wednesday we're doing COVID testing here at the Winter Fire Hall, and we had 27 people come through, which is a lower number. And I don't know if people are getting COVID tired or whatever, But, we're just seeing our numbers going down, which I don't know if is a good thing or a bad thing. But the National Guard comes here from 9 to 1 every Wednesday. And I think we have them lined up until March 7th. So if anybody's interested in getting testing, it's a drive-through, you pre-register, takes you 3 minutes, if even that. So that's pretty much what I've been doing besides continuing to order, stock, and distribute PPE to our multiple healthcare facilities and other first responder agencies. Currently, I'm working with Julia, getting names of people who are in the 1A category for the COVID vaccine and funneling those to the health department. So pretty much still busy with all COVID related stuff, but trying to stay on top of my normal duties that the state requires us to do.
Any questions for Ms. Sanchez?
Thank you, Pat.
You're welcome. Thank you, guys. Happy New Year.
Same to you.
Chuck, you got any questions for Ms. Sanchez?
I do. When you're stockpiling and ordering and doing all the, for the PPE, and then do we, as a county, do we issue the PPE to the schools because they're the county and they're non-for-profit? How does that work?
No, the school gets their PPE directly from the DPI. My stuff comes through FEMA, through WEM, Wisconsin Emergency Management, and that is primarily for our first responders and our healthcare. And there's no cost to them, there's no cost to us. I just keep a spreadsheet. Like we've had some outbreaks in some facilities, and I got called up and had to quick run some PPE up to them, to kind of protect them and their staff and the residents. So no, DPI takes care of the schools, but I have had the school come to me saying, I need additional stuff. And so I can give it to them as long as it's a nonprofit. During our LEPC, I have a faith member who goes around. So we've also given probably, based on this, probably about 4,000 to 5,000 procedure masks to various churches to keep their congregation safe and their staff safe. So yeah, anybody who is a nonprofit can come, but my primary is first responders and healthcare agencies.
Okay, thank you.
Any other questions? Sheriff?
If she's gonna talk about the communications, I'll add after she's done, but before you move on, I just wanted to comment.
Any other questions for Ms. Sanchez's report? Ms. Sanchez, you're up for communications specialist report. Did you want to address that, or is there any questions regarding that?
I think the sheriff will address it because he's been the primary focus of law enforcement with our new upgrades. So I'll let the sheriff take that over.
Sheriff, the floor is yours.
John Kruk presented a report here, and I just want to add, it's been years in the works here, transitioning to a new radio system from Wiscom to our own here. And long story short, we're going to go from 2 towers to 5+ towers. It's been under testing here. We have transitioned some of our deputies to that system in the last 2 or 3 weeks. Overall, it's worked pretty well. We're hoping to transition the whole sheriff's office and other agencies following next week after some radio training first here on the basics of what the change is and how to and what to do to transition to the change. So next week, if all goes well, that will happen. And then following will be the fire department systems and the ambulance service with paging. So by next month, we hope to be able to share with the committee on how that function transition, how it went, and hopefully we have some very positive reports. We're pretty optimistic so far. Everything's indicated it's going to be much better. So we're pretty excited in that. And that's definitely been a concern safety factor wise with communication issues. So we're optimistic and hopeful there.
Any questions regarding the communications report? Mr. Peters?
Yes, I'm just wondering, is the communications functioning down in the Draper area? Is that part of that system?
It is, and it should enhance communication down there.
Okay.
It's probably our biggest shortfall is Connors Lake area. And the intent is to work on that as well and maybe put another antenna on the, we're hoping to put it on the DNR fire tower down there at M and W.
Yeah, because there have been concerns from the fire department in particular, in the Draper and Winter area about communications.
And we share the same concern because where the areas they have trouble communicating in is the same areas law enforcement has trouble communicating.
Chucky, any questions regarding the communications report?
I do not. Sounds good.
Any other questions? Okay, moving on. Criminal Justice Coordinating Council update. Council met yesterday, January 6th. The MOU is in draft form and it's going in front of the tribal council. Essentially what the MOU is going to be is a 3-year agreement between the county and the tribe to provide financial support for essentially the criminal justice recommendations to try to increase the efficiency, which includes bail bond, testing, alternatives to incarceration, and other programming to deal with either meth, heroin, other types of addiction and substances, incorporating CCS. That's still, the draft is being circulated among the, I guess, the major decision makers regarding the MOU, and that'll be presented to this committee in February for review and possible recommendation to the full board. Justice Point, their contract has been signed. There was some last minute discussions, basically some technical revisions that were made to the contract. Their team is now in place and their team was introduced to the committee yesterday. They hired one local, I think 1 or 2 local people that were local to the region, and they will be beginning their duties here in the next couple of weeks. Justice Point will be meeting with the various stakeholders being identified as the judge's office, the DA, public defender, sheriff's, jail, and then the tribal counterparts during that same time to kind of ascertain what the level of services that are going to be needed, and also to develop a method of reporting back to the CJCC in terms of progress and other services being offered. Other than that, there is that was basically it from that meeting. Is there any questions? Chuck, you got any questions regarding CJCC?
I do not. Thank you.
Okay, moving on. Ambulance report. Nate, floor is yours.
I have a couple of other things to add. For COVID, as I put on there, we do fall in the 1A category. Most EMS personnel do. We so far have, I want to say, 16 staff members who are either scheduled or have at least gotten the first round. There's 6 of us who will be getting our booster shots today and tomorrow. And then today and tomorrow, the rest will be getting their first round. That, of course, is an option. They don't have to. They're not required to get the COVID vaccine. But everybody that wanted it has been offered it and they've been scheduled. So. And then we will be helping, it sounds like we will be helping with public health for the vaccination clinic starting next week. And that's just kind of monitoring patients after that they get the COVID vaccine. You have to just monitor. So, and then we did order a new Zoll cardiac monitors, which we're pretty excited about. And hopefully those will be arriving soon. Once they do come, we have scheduled a training session with the resuscitation lab with Zoll. The gentleman comes up from Milwaukee and we'll do some best practices with new equipment for resuscitation. Starting next month, I will be adding more data into my reports also and breaking down respiratory issues and some of that. So overdoses for you. Other than that, I don't have a lot.
Any questions for Mr. Dunstan?
Yeah, I do. Nate, when we talked before about these AEDs, you guys go around and check them. Have you started that yet?
Yes, we are continuously doing it. We have, Jim actually has done a few of them for me. We've been kind of a little slow, a little bit slower than what we want to, just because short staff and everything else. So.
Yeah, just, and I brought it up too, that we have one over at our Head Start Center that I believe it gets neglected. Nobody has really been checking it. And I look at it once in a while, but I really don't know what I'm looking for. They told that I looked at it. I believe that we should get somebody, I wish you guys would go over there and check that out when you have time. Okay.
Ron, what Head Start is it?
It's just the Hayward Head Start over here on Beale Avenue. It'd be the east end of Beale.
Can I go over and do it this morning?
Okay, because there's somebody there this morning. So.
Yep, we can do it.
Any other questions for Mr. Dunstan? Mr. Schluter?
I didn't get the report, but I thought it was going to be on here. So if I'm asking the questions, probably refer to the report if that's right by the answer. Your that was the budget for 2022. Deficit.
So I haven't seen the full thing yet because we just wrapped it up. But COVID does seem like it has had a little bit of an effect, especially call volume wise, of course, what we're billing, what is billable. We're also have to do some more follow up with our billing company. The last couple of months, we've been seeing some decline. We're not really sure why that is for the revenue side, when our numbers are just pretty much been the same. So we're trying to work with that. Expenses were up a little bit, especially operating supplies for the beginning of COVID, because, Pat Sanchez has helped quite a bit recently with FEMA and the state PPE stuff. But at the beginning, we pretty much had to order, and we had to get our hands on wherever we could. And some of those supply costs went up, increased quite a bit from what we would normally pay for gloves and masks and everything else, which isn't surprising. So I don't have a number for you at this moment.
Any other questions? Chuck, you got any questions for Mr. Dunstan?
I do not. Thank you.
Hearing no more questions, we're moving on to number 15. Number 15 was a continuing item that had been brought up back in a couple months ago regarding the fire protection services within the county. We were going to have Rebecca, Mr. Hoff, look into some of the questions or some of the offerings that were going on for fire protection services. Mr. Hoff, you wish to address this?
Yeah, we've also got Rebecca on the line, who I think looked into the statutory requirements on what the county is obligated to do under statute. Rebecca, do you want to chime in on that first?
Sure, thank you. Under Chapter 59, as you know, the county cannot do anything unless it is given specific statutory authority to do so. The county is given the opportunity to provide appropriations for fire services. It also has the statutory authority to assist in other mechanisms, but obviously the county is not, does not have statutory authority, nor is it granted statutory authority to provide specific fire protective services. So the county's role is really an assisting role, if you will, for the municipal fire protection services. Again, that can come in the form of appropriations or other assistance, but unlike ambulance service, the county does not have authority to have its own fire protection services. Now, that being said, I don't know if there's other specific questions that this committee has or the county has regarding other explicit obligations, and I'm happy to answer those or attempt to answer those.
Mr. Peters, I'll let you lead off with any questions that you may have.
I guess that clarifies my questions. And I just wanted to be sure we're still obviously laboring under a very small number of volunteers in the fire department in the Draper area. And that is a concern to the community. But I think it's a concern to many communities in Sawyer County.
Any other, we go to committee members first. Is there any committee members that any questions for Ms. Roker, or any questions regarding fire protection, or any comments regarding fire protection? Mr. Slater.
For Ms. Roker, the county has no authority to do this, but if the townships want to grant us that authority, is that appropriate or inappropriate?
Townships cannot grant any sort of statutory authority to the county. So if a township wanted to pass off its obligations and the county was willing to accept those from a township, I don't think the county could do so. Again, because of its lack of statutory authority. Now, that is the specific question of providing fire protection services. So, you know, think of it as having a county fire department. The county can't do that, and the town can't pass off that requirement for those services to the county. Now, that being said, the county does have, you know, sort of a generalized police power to provide for the health, welfare, and safety of its citizens. So if the question is framed as to whether the county is acting within its proper police power role, that's somewhat of a different, broader and more, but yet more in-depth issue. You know, I'm looking to the specific question of whether the county can or has to provide fire services. So I think it was Mr. Peters who raised the question of, you know, whether the county is essentially protecting its citizens in the town of Draper. Again, that's more of a broader question that we can look at based on those specific facts. And I want the message to be that I'm looking at this from a very specific, pointed question of whether the county can or must provide fire protection services.
Okay, thank you.
Mm-hmm.
I still have some questions, but I'll wait.
Chuck, do you got any questions regarding the fire protection issue?
I do not.
Mr. Slater, do you still have?
Yeah, what is it exactly we're being asked to do?
It was a question that Mr. Peters brought up in terms of the Draper adequacy, and if there was a county responsibility for addressing that. There was a concern because this is fire protection, public safety is, it's not a misnomer, but it's a committee with certain limited jurisdictions, and that sometimes gets misconstrued as being responsible for the safety of the whole county. And so I think that's where the origin of the question came from. And then the second part of that was, what is the county's responsibility in terms of assisting if a municipality or if a township is unable to meet the protection needed in terms of fire protection. And so Ms. Roper was brought in to kind of analyze that. Mr. Hoff was going to meet with somebody, and I can't remember. So I'm not going to blame Tom Hoff for this, but Tom, do you have anything else you wish to add to this?
No, I can touch base with Mr. Onerheim again. You know, he had some ideas as well and has some experience in the fire department realm. So I'll touch base with Mr. Onerheim, and if we have anything to bring back next time, we'll do that.
All right, so is there any other questions regarding this issue? Anybody from the floor, Mr. Schlitter?
Well, I'm still confused about it. I don't think we should even be attempting to stick our nose into that particular area.
Right. And so what I was going to recommend is that this be taken off the agenda, that Mr. Hoff work it through with Mr. Onerheim, with Ms. Roker, and if the issue needs to be addressed by the committee, that it'll come back at Mr. Hoff's request, and then that'll be considered, and then we'll move forward to that one. Because I have the same concern. I don't want to have public safety be misconstrued that we need to be responsible for every single safety aspect of every single component. And we want to respect the autonomy of the townships and whatnot. And then if it does rise to a level of some kind of crisis, then it won't be our responsibility, but we'll be there to, to address it then. Anything else regarding this topic?
Yeah.
Mr. Buckles.
When this was brought forward by Mr. Peters, he was asking if there was anything that the county could do to help that situation. So I agree with Mr. Schlueter. It's something that the county should not get involved in. It's the town's problem, and they should seek where they can get the help from. I mean, Mr. Hoffman, this fella here is gonna try to help them, but as for the county doing anything, I don't think there's anything we can do.
I mean, I think it goes right to a state issue rather than a county issue. So, I mean, there's other avenue, there's a better avenue. It's not that the county comes and there's no help. This is not the proper venue for that. It probably needs to go to the state. And there's state agencies that can be in a better position to provide that assistance. So.
Right, and I agree with that because and I feel for Loretta and Draper up there that they need help, and I'm hoping they can get it.
I'd like to thank the committee for spending the time to consider this and to answer the questions that have been answered. We're still kind of between a rock and a hard place, but that's the purview of the town of Draper, and we're going to have to work that out to find out where we can get appropriate fire protection for our citizens. Thank you.
Donovan, you have anything else?
No, I'll get a hold of our state representative for this area and talk to him a little bit and get some, and I think you contact him also. And I'll work with him, work with Tom.
All right. Moving on to number 16. This is back on only because we were going to do a test run for the 9 o'clock start time. It's been tested. And is there any comments, any concerns, anything, recommendations? Do we need to consider any different changes? Mr. Buckholz.
Being we're COVID and we're still going virtual and for Mr. Van Etten, I believe we should just leave it at the 9 o'clock start time until this COVID and virtual stuff is done, and then we'll take a look back at going back in our 8:30 time.
Mr. Schlueter?
What's going to change between now and when COVID is over?
Well, I believe because then the virtual will be no longer out there after the COVID is done. And then these virtual people will have to either attend the meeting or not be here because the virtual won't be out there.
So, but the reason for moving from 8:30 to 9 was
for Mr. Van Etten.
To attend virtually or in person.
Virtually.
And that's not really going to change, is it?
I don't know. So Mr. Van Etten asked for this consideration. We talked about different days, different time slots. And so the compromise that was able to be attended to, and it's not ideal. It's the least restrictive measure that we could do was that Mr. Van Etten's duties and responsibilities peaked at about 8 to 8:30. And so he was unable to even call in or be able to participate. And so starting at 9 o'clock alleviated some of that pressure. So he was able to, hand off some of those virtual and other phone call responsibilities. So that's why we ended up where we're at right now. What Mr. Buckholz is that in light of this and in some other committees, the full board suspended the restriction of the virtual participation because it was supposed to be, I think it was like limited to like three before it became something else. And Zoom and virtual is probably going to become more prevalent, and the technology's improved, but the rules don't permit that. And it's supposed to, we have this oath that we've, careful what we say about the Constitution, but we have this responsibility to participate, and it's understood that participation was in person. And we haven't yet evolved to this idea of the virtual being the equivalent of that. So, Mr. Van Etten, I don't mean to speak for you, but do you wish to address this?
I do not. And it works out for me, especially now in the off season for me. And in the event that, you know, I thought that I can go one virtual meeting per month out of all of them. This would be one that I would have to do. There's no way I can ever make it during the day. And so I can get with the full board and see if I can be placed on a different committee, because that way anything that meets at night I can do, but having the full-time job during the day, it's irregardless. The 9 o'clock helps me, but in the future, if because of COVID and it all subsides and I have to be there in person, it's not going to happen.
Mr. Peters, anything you wish to add?
Not really. I may have the longest travel time in order to get here, but as long as the highway department keeps the roads as clear as they are, I'm in good shape. So.
All right, Mr. Hoff, so what do we need? Is there any formal action that this committee needs to do, or do we just status quo? Do we?
Yeah, nothing at this time, no action needed by this committee, but I do think that we need to review the board rules on, you know, the virtual attendance and just see where we're at with that. You know, you mentioned COVID and we were under an emergency order, you know, when those rules were changed, but I think I need to review that and maybe bring that to admin committee if there needs to be any updates to continue the virtual meetings through the COVID situation here yet, or, you know, just what the board wants to do in the long term for virtual attendance. You know, as you say, virtual meetings are probably going to continue whether you require board members to be present or not. We'll still probably always be recording and providing these meetings open to the public, but then the board can decide how they want to address the attendance of members, either in committees or the board in full.
Anything else to kick this dead horse? Anybody else?
Well, I would just like to see Mr. Van Etten stay on this committee. I believe he's an asset. So I mean, I would like to see whatever we can do to help him stay on it. I know his job comes first, but if there's something that these guys can take a look at, that's fine. I just like to see Chuck stay on public safety.
Any other comments? All right, so we're going to maintain status quo. Mr. Hoff will report back if there's any changes that we need to take under consideration. Mr. Van Etten, your participation is valued, and I reflect a little bit of what Mr. Buchholz says. I do know that you take this committee seriously. So anyway, that's it. Moving on to number 17, any future agenda items?
Does that mean stays at 9 then for the future?
Yeah.
Okay.
Any future agenda items? Anything else you want to talk about in the future on any topic?
I have something for discussion.
Okay,
So
let me finish this one and we'll go to the next one. So nothing on 17, moving to 18. Correspondence, reports, conferences, and other matters for discussion only. Mr. Van Etten, the floor is yours.
We get a lot of emails, and this is this day and age, and everybody like me over 50, I have a heck of a time with all these emails. Is it possible that for all the meeting notices and all the stuff, a calendar could be emailed out showing all the dates? Because what I find is there'll be a lot of updates, and then someone will add something to the agenda, and there'll be like one subject and 6 emails. And then I scramble the day of the meeting trying to get that so I can get the Zoom address, and I try and put this all together. Is it possible we could just have a calendar that comes out once a month and that does not change? So it'll say public safety today and HHS next week and full board meeting Thursday. Is that something we could look at?
All right, so let me offer this, Mr. Van Etten, as another person who receives a lot of email. I think this is an inevitable, it's an unavoidable issue, because anything that's posted needs to be posted and made available to the public. Email has been a convenient alternative to posting it in the newspaper and, hammering some kind of thing outside the door, which is probably what the old methods were before we had email. And so I don't know if there's a way that we can get around that, other than maybe instead of every single moment, everything goes posted like we do it once a day or once a week or something. But in light of some of the analysis and scrutiny that this county board is under regarding certain issues, that opens up criticism to the board. If we have something that becomes an item that we're going to be discussing and it's not publicly made available, that invites a lot of commentary from various aspects of our county in terms of whether they feel that they're been invited to discuss it and whatever else. And so I want to remind everyone that we had some pretty contentious issues with the public health ordinance, with the Second Amendment, and we had allegations that we were either not forthcoming or too forthcoming or too exclusionary or too overbroad or whatever else. And that there really is no happy medium. There's just what we have to endure as part of the things that we do. So I'm going to say this not to be flippant, but this is the work we've chosen, and sometimes there's some things that come with it that are a little bit uncomfortable. So Chuck, I don't know what we can really do to address that. We also have a brand new clerk who is trying her best to maintain the standard of excellence that we've been doing in terms of communicating, and so just trying to provide her a little bit of an ability to adjust, and so we'll figure out something. But I mean, your concern's noted. You're not the only one that's brought this up.
Mr. Chair.
Mr. Hoff, go ahead.
Yeah, thank you. A lot of the emails that I think Mr. Van Etten is referring to are, the updates to the agenda. You don't just get an agenda, you get an agenda and then 6 or 7 updates after that. And part of the reason for that is making sure that we get the most recent updates or information or reports on the agenda. And I think we as staff need to do a better job in working with the clerk to get those in by a deadline so that you don't get update after update, that we have a more resolute deadline that staff can get information to the clerk, and you get one agenda and that's it. And then if it's after that, we'll have to address it next month. So we'll work harder as staff to eliminate some of those updates that you get.
No, and I still get that, and I have no problem with all the emails. But what I want is just a calendar with each meeting. So if there's a meeting on Tuesday, a meeting on Wednesday, and it's not changing, I get we got to have updates. I get that the public needs to be aware. I just want a blank calendar so I know when that email comes in for, say, February, I know I got a meeting here, here, and here, and I can plan accordingly. It would just simplify that I miss things because there's so many emails.
You have that on the website? Mr. Slater, go ahead.
Yeah, Chuck, I agree with you. I do the same thing. I kind of scramble to make sure that I've got everything on my calendar. And that usually involves calling and are we sure it's this day, not that day. No reflection on a new clerk because she was not around then. Neither was a previous one. Chris Mayberry used to put a calendar every month in everybody's mail slot in the county clerk's office. And it was just a simple calendar with 30 squares on it. And every regularly scheduled county board meeting was there. And if you had other special meetings, you could fill it in yourself, put it up on your wall by your desk or wherever, and highlight the days you had to be there. And it was just very useful to me. I missed it when they took it off, when they quit doing that.
Do we have something on the website?
Yeah, on the front page of the website, there is a calendar that lists the meetings for that month.
This is Dale. Dale doesn't know how to get that off.
Lynn, is that something you think you could do for that, or do you have time?
I did create one for the year for my purposes that's color coded. It has every meeting for the entire year on there. if something like that would be beneficial, I could change it to a single monthly format. It's up to the board if they would like.
I mean, like, I know Chuck wants one and Dale, I would like one. I mean, I pretty much can get it off my iPad anyway, but it would just be something I think would be handy.
Totally doable.
But if you got the time, if you don't have time, I understand that's hard too, but.
And send it to an email.
Well, I
That
don't,
you'd have to print, or is that not, you don't want to print?
I don't know how
Okay.
often, like, Mr. Van Etten gets in and checks his mailbox, so, but.
That's the problem, is they're, if we put them in the mailboxes, you'd have to physically come to get them, unless I put them in a board pantry, but still some are virtual.
So people come in and check the mailboxes.
Mm-mm, not much.
I don't know, every board meeting Carol used to bring one.
So Dale, were you on the board before there was a monthly calendar? Or?
No, it wasn't. It was there the first night that first meeting I attended.
Right, well,
We'll investigate.
yep, so, Madam Clerk will look into that, Ms. Fitch, Mr. Hoff, and, see if there's something can be put together. For the other committee members, is there anything else? Any other matters you wish to discuss? Mr. Peters? No. Mr. Buckholz? Good. Mr. Schleter? Mr. Van Etten, do you have anything else you wish to bring up?
Oh, I'm good. I don't want to push my luck.
All right, well, that concludes our broadcast for today. This meeting is adjourned. Thank you, everybody.